Hello, I'm Brianna, a Coloplast Care program team member, and I'm here with Maria, an advisor for the program. Adjusting to using an intermittent catheter can be difficult. You may have questions about how to catheterize, your routine, and how to stay healthy and compliant. It can be a confusing time, and we're here to help. Coloplast Care is an ongoing product and lifestyle educational support program to help intermittent catheter users stay healthy and become confident in their routine. Many clinicians enroll their patients after prescribing intermittent catheterization in the hospital, rehabilitation center, or during an outpatient visit. Or you may have chosen to sign up for the program yourself. When enrolled in Coloplast Care, you'll receive a welcome call from an advisor within 24 hours of leaving the hospital. You should expect a call from your advisor to come from a 612 number, so be sure to check your voicemail and save their number in your phone. They'll leave a message if they don't reach you, and you can call whenever you need assistance. Your advisor will help you answer questions, troubleshoot, and can even send product samples, with the ultimate goal of meeting you where you are in the learning process to help you be successful in your new routine. You'll also receive a free welcome kit in the mail, which will arrive in about 2 business days. We send a shipping notification, but that only happens if you choose to include your email. Including an email is helpful because a lot of catheter users forget some of the product information shared by their healthcare provider at the hospital. But if they see the email, then they know what to expect. That can really help when returning home, to know that you have a connection to someone who has experience with what you're going through. If you do have an email, you'll also receive a welcome message from the Coloplast Care team. You can complete your profile, which helps customize the content you receive, which includes helpful resources for traveling, intimacy, diet, activity, and more. Maria, do you want to show us what the welcome kit includes?
Definitely. The welcome kit comes in a bag like this. And as you open the bag, you'll find a booklet on understanding urinary tract infections, or UTIs, and the basics of intermittent catheterization techniques. There's also a practical guide to bladder health that covers nurse-validated tips to maintaining a healthy bladder. You'll also find the bladder diary, which can help you track liquid intake and outputs to help you stay hydrated and follow a catheterization routine. There's also a disinfectant gel bottle for convenient sanitization on the go. Finally, women receive a purse and men receive a bag to carry their catheters. Women also receive a leg mirror to help while catheterizing.
That's a lot of great resources to help intermittent catheter users get started. Could you tell us more about what you do on the Coloplast Care advising team?
Of course! I connect with individuals who may have recently enrolled in Coloplast Care for intermittent catheter users. Within the first 24 hours of enrollment, I call to help answer questions and meet you where you are in the learning process. Using an intermittent catheter can be a big life change, and it can take some time to adjust to using one. So we start with education around how to use the products, maintain a healthy bladder, establish a routine, and tips to help avoid UTIs. I can assist if you need help ordering or receiving catheter supplies, and help you overcome any barriers to accepting intermittent catheterization. I can also help you better understand your catheter insurance coverage and can advocate for you by working with a dealer that dispenses the product your doctor prescribed. I can also connect you with a care network in your area, like distributors and peer support groups, and can recommend contacting a healthcare professional if needed.
That's wonderful. What other support does the Coloplast Care team offer?
After the initial conversation, your Coloplast Care advisor will reach out again for a follow-up within about a week to make sure you get any samples and have enough catheterization supplies. They'll also discuss the importance of adherence to a routine and help integrate and support intermittent catheterization in daily life. Following this check-in, advisors call at an agreed-upon time, typically about after a month, and then again after 3 months, to help with troubleshooting, technique, or lifestyle questions. From there, we can follow up as needed, or you may choose to reach out to us for questions about troubleshooting, products, or new needs.
Thank you so much, Maria. If you're watching this video and have any questions, you can reach out to the Coloplast Care advising team in the United States at 866-226-6362. You can also sign up at www.bladder.coloplastcare.us. Information from Coloplast Care is for educational purposes only. It is not intended to substitute for professional medical advice and should not be interpreted to contain treatment recommendations. You should rely on the healthcare professional who knows your individual history for personal medical advice and diagnosis.